Am I audible?
Yes.
Yes.
Hello everybody. On behalf of our Project Core Team India, we welcome you all to participate for today's webinar. As a part of training and capacity building of this Project Core, we are having the fourth webinar in our ongoing webinar series that is on qualitative evidence synthesis methodologies that matter. So this session is introduced to stepwise process the conducting system and case studies. It will show you how qualitative evidence can add depth, extent, and relevance to the research findings. So this is a basic introduction session to help you understand the grassroots of the topic. Today's session will be of 1 hour and the last 15 minutes is dedicated for the question and answer round. So the participant, you are free to post your questions in the chat box down below, or you can raise your hand to directly contact the speaker. So now, once again, I'd like to thank you all for joining us here today. And I would like to invite the principal investigator of this project from Team India, Professor Abhishek Mehta, to take the platform and please introduce our guest speaker of the day. Sir, over to you.
Thank you, Barsha, and good afternoon to each and everyone who's present today. It's a privilege for me to introduce Dr. Vinita for today's webinar. She is the additional reader and deputy director at prestigious Amrita School of Dentistry, Kochi, and she is heading the Center for Evidence-Based Oral Health over there. I think one of its kind in India. She's a certified trainer in teaching systematic reviews, scoping reviews, and has expertise in developing protocols, conducting reviews, translating evidence into policy and practice. She's also an active contributor to the national and international evidence network, which is there for health and oral health, and is a qualified methodologist with expertise in qualitative methods, mixed methods, psychometrics, and along with her specialization in dentistry, she is actively involved in health promotion and disease prevention. So with these few words, I'll hand over the mic to Dr. Vinita and welcome her to Jamia for this webinar. Over to you, ma'am.
Thank you so much, sir, for the lovely introduction. In fact, I was just remembering I started my first systematic review with you. So it's been some time, but yeah. So thank you so much. It means great coming from you and this opportunity. So, and thank you everyone who's attending. I think it's an afternoon. You all dedicated time to learn about qualitative evidence synthesis. That's a win for me. So I shall start without any delay. Hope you can see my screen.
Yes, we can see that.
Okay, great. All right. So good afternoon, everyone. As Dr. Abhishek Mehta introduced me, I am currently working as an additional reader in the Department of Public Health Dentistry. My background is public health dentistry, and I currently work in Amrita. And I'm also part of JBI collaboration, which is into evidence synthesis, evidence transfer, and evidence implementation. And currently, I'm focusing on evidence synthesis. And this topic is very dear to me because qualitative research methodology, I've always had passion. And the next step in my career was to see how can it be useful to policy or practice, the simple study that we generate from qualitative, how can it be useful? So I followed my passion towards that, and I got enrolled in qualitative evidence synthesis methodology group in JBI, and we are currently working on different methodologies in which qualitative evidence synthesis can be done. So to begin with, I'm sure most of you know what is qualitative research and what exactly are the steps in that. But anyway, just to give you a small introduction to what it is, when we think of qualitative research, we use these terms like in-depth, in depth, we get to know people in depth, we get to know the complexity of human behavior, attitude, rather than numbers. So that is what is different from quantitative. That is, we are going in deep and understanding something. And the method which we understand is very unique. We'll be doing it through interviews. We'll be doing it through observations or analysis of texts which are generated by people. So in that way, what we can think of when we think of qualitative research, think of it as a very naturalistic form of inquiry, rather than something with a very set of rules, just like how we do any quantitative study. So in that way, this is the broad differentiation into different study designs. There is quantitative, there is qualitative, and there is mixed. And in qualitative, we follow an inductive approach where we are going we are going blind and collecting data and then generate a hypothesis. While in quantitative, what we do is we already have a hypothesis, we test it and then use statistics and test or reject or accept the null hypothesis. That is how we go ahead with quantitative. So in qualitative, the setting is very natural, very comfortable where this phenomenon occurs, while in quantitative, it's very controlled. That is how we do the experiments or observations in a controlled setting. Sampling, we say qualitative sampling is a bit easy, but it's most of the time purposeful sampling or flexible sampling. In quantitative, we have random sampling or any other type of sampling strategy. Data collection is through interview guides or observation tools, while in quantitative, we do surveys or measure the outcome in whatever ways we want. In qualitative, data analysis is actually iterative interpretation, or we say thematic analysis, or there are many different types of analysis. We are just making sense of the words. In quantitative, there comes the biostats, right? A lot of statistical tests, modeling, which helps us understand the data. So this is just broad classification of quantitative, qualitative. And now we have methodologies in which both are together. For example, mixed method study designs in which there is a qualitative, quantitative component. There are different types of mixed methods, which is out of scope of this webinar. So we'll focus on qualitative, what are the different designs and how is it qualitative research done and how can we do or synthesize individual studies into a pooled finding. Okay, so that's what today's webinar is about. And this is one question I often ask. You think qualitative research is important in healthcare? And 90% of our research is more focused on getting those numbers and quantitative. So does qualitative research have a role? Is something that we need to think about. So yes, I feel yes, there is a role for qualitative because it gives us the first-hand documentation of patient experiences that a number cannot give you. It gives you suggestions for improvement. If you want to improve a treatment, some things numbers cannot explain. So those things qualitative research can give us. Ability to detect common concerns and desires associated with quality of care. And information about what matters most to the patients. So these type of open-ended information, we cannot get through a questionnaire in which everything is set. And the opportunity to identify obstacles to growth and change and lots more. These are just few things which I have put. And right now, why qualitative research is in trend is because it's mostly in implementation research where we do mixed methods, right? So there will be quantitative, there will be qualitative, and qualitative actually supplements quantitative, and from which we understand, especially in public health, why a program is not succeeding, or why is it not reaching to the level. We go back to the community, find out what's wrong. And qualitative research methods is one of the ways we do that. So again, I'm just touching upon the basics here. What is the structure of a qualitative research? So just like any research, first and foremost, we start with a research question, and then we select a qualitative research design. So there are many designs available, a lot are there, but the major ones are listed here. That is grounded theory, ethnography, phenomenology, action research, case studies, historical studies. You may have heard a lot more, but these are just simple designs, and when and where to choose them to know is very important. So you start with your question, select these methodologies based, which will best answer your question. Go ahead with sampling. There are different sampling techniques. One of them is purposive sampling, which is the most common. collect your data through interviews or observations or textual analysis, do the data analysis. So most of the time, how do we do data analysis? It is through coding. So I hope most of you may have heard about coding in qualitative, how we code, how we condense data, and then we check for qualitative rigor. So this is very important. How is a study done? In quantitative, we look for things like risk of bias, right? Blinding, all that we check for in RCT, whether randomization, blinding, etc. is given. Similar to that, there is a concept in quality which is called as qualitative rigor, which establishes validity to qualitative findings. And then finally, reporting findings. So this is just how we go about how to do a qualitative. This is just the basics. There's a lot more. Okay. So a small note on what is qualitative data analysis. So if you look here at this picture, the idea of qualitative data analysis, you look here, we start with a lot of codes and then it gets condensed to a theory. Okay. So that is what is qualitative analysis. It's about reducing data without losing its meanings. You may have a lot of pages and pages of data. You code it and reduce it and reduce it and reduce it without losing meaning. I know it sounds, difficult to do, but once you start doing it, you'll understand how to do it. So you have your codes, which you condense to categories, you condense to themes, and this is where most of the qualitative data analysis stops. And sometimes if you're doing something called a grounded theory, you will again condense these themes to theory. Okay. So this is how qualitative data analysis works. And what exactly is a code? It's a word, phrase, or sentence that represents aspects of a data or captures the essence or features of a data. So nothing but verbatim excerpts from the interviews or observations which you have done. That is what is codes. So I'm stopping here regarding what is qualitative research. Again, that is not what we are here for. We are here to learn about systematic reviews. So just like quantitative research, for example, RCTs, if you want to prove that an intervention is working, we need studies from different parts of the world stating that, yes, this works here, or what is the status? Should a policymaker invest in an intervention? So they always look into evidence in the form of systematic reviews or evidence guidelines, right? So how they do this is by combining individual studies and making a pooled estimate or pooled synthesis of that. Then you can say, okay, it works or it will not work. So systematic reviews are currently really used for knowledge transfer. And you may be familiar with this picture here. This is there everywhere. Whenever there is systematic review, this picture is there. You can see studies, which are individual studies going in through a sieve. And some of them gets removed and some of them will be there. And finally, you get a sense of what is there. It forms into a nice triangle shape, right? At the end. So that is what a systematic review. Individual studies undergoing checks, that sieving through these, and then we'll select those which are relevant to us. And at the end, all those selected studies are combined together to make sense. So that is what a systematic review. It aims to provide a comprehensive, unbiased synthesis of many relevant studies in a single document, and it uses rigorous and transparent methods, which is why it is superior to any sort of literature reviews. And systematic review stands above RCTs in a hierarchy of evidence. So similarly, for quantitative, you have these studies which are combined together, and for qualitative, we have the same approach. A qualitative systematic review, what does it involve? Synthesis of qualitative research findings to generate new insights and understand a phenomenon of interest. This also has all the elements of quantitative systematic review. You are doing it in a systematic, transparent approach. You are incorporating rigorous methods to collect, appraise, and analyze qualitative studies. So one of the ways which we can begin evidence synthesis is actually through a qualitative review and then progress to a quantitative review. So I think evidence makers and policy makers suggest this. Do a qualitative review first if there are studies, which can be followed up by a quantitative review. So application of qualitative research to synthesis, actually. So as with quantitative research, results from a single study only should not be used to guide practice or policy. So here we can use the research from multiple qualitative studies, combine them or synthesize them, and then develop recommendations for practice, just like how we do a quantitative study. And now, definitely there is an increasing interest in the potential of qualitative evidence to inform complex decision-making process in policy and practice. Policymakers are looking into findings from qualitative research, so it is definitely important in current scenario. Yeah. So I'm just going into how to actually do a systematic review. Don't worry, I'm not going to take a long class or something like that, but these are the basic steps in which you can do a systematic review. It starts with a research question, defining your inclusion-exclusion criteria for the selection of your article. Then you go and do the literature search, go to these databases like PubMed, CINAHL, etc., collect those articles. And then two of the reviewers will sit and select each studies, which one will be included for pooling, which one will be excluded. And then each individual selected studies will undergo critical appraisal. So how good is this study methodologically? That is what is called as critical appraisal. A study passes through critical appraisal, it goes into data extraction, in which what all relevant data is needed to answer your review question, you're taking it. Then you do the synthesis, that is, can the data from this extracted, can it be pooled? And then you pool the data, present your results. And there is also one more step which currently is in trend, which is the grading or establishing confidence in the results. So once you say this treatment is really good, how confident are you based on your review? We do a procedure called as, we follow a methodology called as grade methodology. So that is also part of quantitative review. And currently the same grade is actually a part of qualitative review as well. So through this webinar, I'll just introduce you to where to look for resources on how to do this. So these are the generic steps for doing a qualitative evidence synthesis. So I hope you're with me. So we can start with the first and foremost thing, that is a research question. So if your research question is properly framed, half your job is done, because it's so difficult to get a good question. If you know what you're looking for, it's easy to do it, right? So research question is the first and foremost important step. And there are certain guidance available on qualitative research synthesis questions. How should it look like? What components should it have? And I've put a few of them. You're free to choose whichever you want, but these are out there just for your basic knowledge. There is PICO, which is similar to PICO, which we follow for effectiveness studies, that is population intervention control outcome. Here we have phenomena of interest. Here we have population phenomena of interest and context, which is specific to qualitative type of studies. There is SPIDER, which is sample phenomena of interest, design, evaluation, research type. And there is SPICE, setting perspective, interest, comparison, evaluation. And somebody has gotten very creative. They have named a research question as perspective. That's quite cool, right? Perspective. So perspective, setting, phenomena of interest, environment, comparison, if any, timing or finding. So these are just few frameworks out there. If you're doing if you are interested in doing qualitative evidence synthesis, you can follow any of these frameworks. So once you do develop a research question, you make your inclusion-exclusion criteria based on this framework. Then you move on to searching for studies. Now, what do you usually search for? I think all of us are familiar with databases like PubMed, Medline, Scopus, Embase, CINAHL, all of that which is related to our topic. We may have a general idea. Recently, there has also been few other databases where qualitative articles are really included. For example, just relying on Medline is not enough. So you need to add few more databases where qualitative articles can be published. For example, it's CINAHL. So there is some interesting phenomenon to note. Nursing research is in nursing, there's a lot of qualitative research. Okay. And CINAHL is one database you can see and search for. There is also one more database called DIMDI, which is German database. They also yield actually a good number of qualitative studies. And CINAHL has actually introduced qualitative studies as a mesh term. So mesh term is nothing but medical subject heading, which is used to catalog classifications of terms, which helps us to do literature search. Okay, you may have heard about mesh in Medline. So CINAHL is one of the first databases which introduced qualitative studies as a mesh term. So if you're doing qualitative evidence, just don't miss CINAHL. And right now we say we also need to look into gray literature. So gray literature is anything which is out of the commercial publication realm. And that also actually gives us a lot of information. So you can look into thesis, process evaluations, hospital reports, research reports, conference proceedings, etc., etc. So these are some other sources which you can have a look to get qualitative studies. So I always look into gray literature. They give us really good insights. They give us information on negative results, null results, which couldn't get published. And I believe, or we should believe, that that is also important. So conference abstracts of proceedings, these are few of the databases you can look. PhD thesis and dissertations, you may have heard about ProQuest, WorldCat, dissertations, ethos, and most of them are freely available. And gray literature databases like OpenGray, Gray Literature Report, TripPro, and all that, most of them are free access and you can access and add this to your search. So it's complete. You're not falling for the publication bias. You're taking into account all the information everywhere to answer your research question. So once you have done this, selected, got your studies from all these databases, you need to actually select them, and then after your selection, you have to critically appraise them. Now, this is interesting because in quantitative studies, we have a lot of criteria, right? To say a methodology is rigorous, right? A paper does not have risk of bias. And we have these kind of terms: reliability, internal validity, external validity. We use that. But can we use it in qualitative, which is very context specific? So there has been a lot of deliberations on how to do a critical appraisal for a qualitative study. There are so many things to take into consideration. So that's when a few terms have been developed, that is dependability, which is analogous to reliability, credibility, which is similar to internal validity, and transferability, which is similar to external validity. Now, these are not literal terms. There has some meaning to each of it, and there are some ways in which you can bring in these concepts to qualitative. For example, credibility. When we say credibility, which is internal validity, we can say the data which we got is trustable or trustworthy. So there are different ways in which we do this. Like there is something called as member checking, in which we collect the data and then give back the data, the interpretation which we have got to those who collected the data. For example, one person, we are interviewing them, we get the data, we analyze it, and the results which we have got, we send it back to that person, and they should check it and say yes or no, something like that. Okay, so that is what is member checking, including study materials, thick description of data, and researcher triangulation. So many things. One researcher does the analysis, another researcher also does the analysis. So many things are there which ensures credibility. If few things like this are there, then we say, okay, there is some rigor in the way in which qualitative study has been done. Next is transferability. That is it applicable from one setting to another? So how to understand that is there should be good information on what is that setting. Then only it can be transferable, right? So contextual information about study methods and participants is one way in which we can look into transferability. The next is dependability, which is reliability. So you do the same thing and you should get the similar results. So here you have transparent reporting, audio recording, transcription, computer software. All of this will help you. And we are not looking for the same result as such. What we are looking for is same quality of research. If I do a qualitative study in my setting, and somebody does it in another setting, it's not very sure that the same results we'll get. But the idea is that same quality of results we get. That is what is dependability. And then confirmability, which means findings and interpretations reflect the views of participants. And there is small overlap. We do member checking, researcher triangulation, inclusion of raw data, and reflexivity for confirmability. So this is actually a lot of things to discuss here, but I'm just telling you a few things on what to keep in mind when we do a critical appraisal of a qualitative studies. And these are concepts very similar to quantitative. So you may have heard about critical appraisal checklist, which is available for each study designs. Yeah, so there is one for cohort, there is one for case control, like that. But for qualitative, it's the same checklist is available for all the designs. So there you won't find a checklist specific for grounded theory or specific for maybe a phenomenology. It's pretty much same. So it is one advantage of qualitative research. And there are two commonly used checklists. There are many more checklists being developed once in a while. So this is the JBI checklist for qualitative research. It has around 12 questions, which has yes, no, unclear responses. And each individual study you take, use this checklist and assess the methodological quality. And there is also one more checklist, which is called as CASP, Critical Appraisal Skills Program. This is also a 10-question checklist. And this also does the same thing. You need to use only one. So it's up to you which one you want to choose. There's JBI and CASP available. Okay. So now we have completed critical appraisal. We know the methodological quality of individual studies. What next that we need to do is data extraction. So from this articles which we collected, those data relevant to our research question, we need to extract. So most of the time we'll extract study characteristics, right? For example, context, number of participants, study design, methods used, the basic things about studies, we'll do it. And then qualitative studies, if you look into it, the results will have findings, that is the author's interpretation, followed by the participants' quotes, right? So author's interpretation is called as finding, and the quotes from the participants is called as illustration. So most of the time, in majority of the methodologies for data extraction, we will be collecting these. It's just like how you collect numbers from meta-analysis. For example, each study will extract numbers for meta-analysis, right? So similar to that, we'll extract findings and illustrations from individual studies. And this is guided by data synthesis approach adopted. So in qualitative systematic review, there are different types of data synthesis: thematic synthesis, framework synthesis, meta-ethnography, and meta-aggregation, which is what I use, which is a JBI approach. So excuse me for a second. Right, back. Okay. So I know this is a boring table, but what this does is it gives different synthesis approaches. And you can see meta-aggregation, meta-ethnography, content analysis, realist synthesis, narrative synthesis, thematic synthesis. So what I need you to look for is that critical appraisal. So in majority of the designs extraction forms, we don't need critical appraisal, but for meta-aggregation, that is the JBI approach, it is very important. And I also feel that methodological quality of studies are really, really important. Another thing which is very important is it's all of these synthesis is applicable across study designs. Even if, because that is one interesting thing about qualitative. Different study designs can be used to address the same problem. So this extraction is actually applicable across study designs. And in meta-aggregation, we need a protocol. We need an exhaustive searching. Critical appraisal has to be there. And there is a method in which we condense findings. Findings are author's interpretation. We condense them into categories, and then we condense these categories into synthesized findings. I'll just show you a little bit about it. I'm not going to talk a lot about other types. but I'll just explain meta-ethnography also and understand that there are different types. Yeah. So the important takeaway point from here is that you can synthesize across different methodologies. That means phenomenology, ethnography, or grounded theory, whichever methods, it can be mixed in a single synthesis of qualitative studies as long as they focus on the same phenomena of interest. And meta-aggregation focuses on study findings and not on study data. And this is a critical assumption for meta-aggregation. Now, another one of the commonly used approaches is meta-ethnography. And this was developed by Noblet and Hare. It's a very elaborate methodology. It's well documented. You can just, type in Google or ResearchGate meta-ethnographic approaches, and you will have all the guidance. So I'm not taking too much time into this, but what it does is similar to meta-aggregation. It will identify studies which focus on your research question, and it decides what is relevant to the initial interest. And then you will read the studies and you will see how the studies are related and how the studies can be translating the studies into one another and synthesizing translations and then expressing the synthesis. So how do you do that? There are some interesting terms like reciprocal translation, reputational translation, and line of argument synthesis. So this is interesting. So in reciprocal translation, concepts in one study can be incorporated to those of another. So there are different studies and they all talk about the same thing in the same way, means you can combine them. And reputational translation, concepts in different studies contradict one another. So this study is positive about it, but another study is negative about it. That is a reputational translation. So you need to understand that and make the synthesis. And then line of argument synthesis, the studies identify different aspects of the topic under the study, which can be drawn together in a new interpretation. So you get different ideas from each of the studies, which makes sense, or you understand a different interpretation of it. So it's like a puzzle. So you get pieces of your puzzle from different studies, put it together and make an inference. So it's very interesting meta-ethnography. It's one of the approaches for qualitative synthesis. Again, I'm not going too much in detail. If you're interested, just Google Noblet and Hare and the meta-ethnography studies you can see, and you will be able to do the synthesis. Yeah. Okay. So what we follow is the JBI meta-aggregation approach. So it's very similar to meta-ethnography. So what we do here is we make it something similar to meta-analysis. Okay. So what do we do in meta-analysis? Collect these numbers from different studies and pool them, right? The same thing we do in meta-aggregation. So instead of numbers, we have authors' interpretive findings. So these findings we'll take, pool them together into categories, and these categories again we pool them together into synthesized findings. And this synthesized finding is your pooled estimate. Think of it as your meta-analysis, your final pooled estimate will be there. It's the same thing here in meta-aggregation. So if you want to learn more about meta-aggregation, this is how finally it looks like. So we have a paper on qualitative research synthesis from the methodology group, qualitative methodology group, in which they'll tell you how to extract findings, categories, and how to combine them into synthesized finding. Very interesting process. And this is what we follow. And at the end, instead of forest plot, we'll get a table like this. It's a bit boring, but still, this really helps the policymakers and practitioners to understand what is and how to actually put this information into practice. So this is how a meta-aggregation results looks like. Findings combined to categories, combined to synthesized findings. And this is what is analogous to your meta-analysis flowchart. And any information on how to do this, you can refer back to this paper. Okay. So once we have synthesized, we have, your findings from qualitative studies ready. Now we need to grade them. Grade them means how confident are you in suggesting these findings? Okay. There are two methodologies available. There is the Cochrane. I'm sure you must have heard about Cochrane organization. There is Cochrane CERQUAL, and JBI ConQual. So these are two things, two guidelines available. You need to use any of this. You don't need to use two of it. Any one is what is suggested. And at the end, you will get something called as a summary of findings table, in which there will be a synthesized finding and how confident are you in suggesting this finding to others. There are different criteria. Again, that is out of scope for this webinar. But just have a look at this resource, Cochrane CERQual, and it will tell you how to actually do this. So this is being done after your analysis. And this is how we do ConQual, JBI ConQual. So you have, for each synthesized finding, you have to rate or give a confidence. I have high confidence in my synthesized finding, moderate, low, very low. And a policymaker or an evidence expert, the first thing they'll see is this table, which is called the summary of findings table, which is more important to them. So they know whether, to include this or not, or what is the level of evidence for this. So that is what is grading of evidence or establishing confidence in evidence. And JBI, we use the ConQual approach, which has two components. One is dependability and another is scoring of confidence. In dependability, we use questions from our critical appraisal tool. If you remember, I talked about JBI critical appraisal tool. And these are few questions from there which are important to methodologically assess a study. So these questions we'll see, and based on each response, we'll score dependability. And another one is score of confidence. Okay. Now, if you remember, I told about findings, which are authors' interpretations. And then there are illustrations, which are the participants' quotes. If the findings and the illustrations are really matching, then we say it is unequivocal. If a finding is accompanied by an illustration, but they don't really match, it's credible. If there is a finding and it doesn't have an illustration, it is not supported. So based on this, we have a ranking, which is the score of confidence. And at the end, we'll get something like this table. So as I told, the policymakers or practitioners only look into this table. So this is how it looks like, your synthesized findings, type of research, dependability, and you have to rank it, credibility, you have to rank it, and then ConQual score. So for this finding, it's moderate like that, we have to interpret. Okay, it's just I'm touching upon what is ConQual. So how to, I know there's a lot of exhaustive things to do, how to actually do it with the help of software. I think we are all a little lazy, right, to do it in Excel, yeah. So there are different softwares available. There is Covidence, which is the best, but the issue is it is expensive. You get a trial version of one review, but other than that, no. And it is really, really expensive. There is a software called Ryan. So Ryan is free, but again, the interface is not that friendly. But yeah, if nothing is there and we don't have funding, you can use Ryan. Similar with Cadima, again, Ryan, Cadima, all are free. And if you are doing into qualitative research, you may have heard about the software called NVivo. So NVivo is a qualitative research analysis software, and you get really good visualizations in NVivo. So you can use the same thing, because what we do in a qualitative research is something similar to what we do in qualitative evidence synthesis. So NVivo is also a good software option. And JBI Summary, which I use, it's software which gives end-to-end support to your systematic reviews. So right from the development of your protocol to your full review completion, JBI will provide all the facilities, and it's very easy to use, simple tool. And this requires subscription. I'm afraid it's not free. You have to subscribe. Or if nothing works, go to Excel or use your EndNote for reference management. So these are some tools which helps us to in writing qualitative systematic review or doing it. And this is how JBI Summary looks like. It's a good one. And it's also only software which gives, which helps with qualitative data analysis. No other software will give qualitative data analysis. So here you can make this table which I've showed you, that is a synthesized findings table. You can use make this in here. And each stage, it will help you right from your protocol, screening, appraisal, extraction synthesis to writing your full review. This software will help you. This is how it looks like, your findings, your illustrations, how good are they, do they match, all that you can do it here. Okay, and then after all of this is done, you need to write your paper and write your results, which has to be organized like this. Study inclusion, how many articles were selected, how many duplicates were removed, title and abstract screening, full text screening, all that you have to mention here. Methodological quality, the results of your critical appraisal, how many studies were of good quality, characteristics of included studies, what was the sample size, what was the population, etc. And findings of the review or results of your meta-aggregation or ethnography of qualitative research findings. Again, depends on your research question, how you want to present it. Once this is done, you can write your discussion, conclusion, and very, very important recommendations for practice and recommendations for research, so that there is a meaning in what we are trying to do here and it translates into practice or policy. And you may have heard about review registration and review reporting guidelines. So right now, it's not mandatory, but it is desirable that your review should be registered. And qualitative reviews can be registered in a database called Prospero. So before you plan to submit your review to a journal, this Prospero registration is kind of essential. Most of the journals will ask. And Prospero accepts qualitative systematic reviews. So you can register your review there. If it doesn't work there, you can, sometimes it might get rejected. You're very, very, very unlucky. Then you can go for Figshare or Open Science Framework, where the rejection rates are very less. And once you have done that and you've completed your review, then you also need to attach a reporting checklist. That is, how should you write your manuscript? So I'm sure you're familiar with the Prisma format. The Prisma 2020 is the latest format. In this checklist, there are some 27 items. And each question, which page is what you have written, you have to mention here and attach it as a supplementary file when you submit a manuscript. Okay, I know that's okay, 2:45, it's right on time. So this is how I want to conclude this. In a world where healthcare decisions increasingly demand not just evidence, but meaning also. So we are looking really beyond that numbers, right? So qualitative evidences help us hear the voices behind the numbers. In that way, it is, I think, very much needed, and it supplements quantitative, or it can act as a standalone evidence also. And these methodologies are not just tools, they are actually bridges between evidence, empathy, policy, practice, systems, and people. That's why I've given the title for this webinar as Methodologies That Matter. And by taking up qualitative evidences, you're not just contributing to science, you're amplifying perspectives that might otherwise go unheard. So to conclude, we can say, ask the questions the numbers can't answer. And there is a famous quote that says, not everything that counts can be counted, which is really related to qualitative. So I know I'm not given too many details. I've just brushed upon the basics of the basics, actually. Very, very less. But what I can give you is resources. So these are resources for whatever I have taken, and you can go to that, and if you're very much interested, you can learn about it. If you're really interested and want to get a formal training, I am from a JBI Education Center, and we are qualified to conduct trainings in methodologies, and especially we have a module dedicated to qualitative research methodologies, which covers in our module 3. So we do both qualitative, quantitative, and scoping review. And it's not just us. Across the world, there are many training events in JBI. In India, ourselves, we do it, and one more institute in Kerala does it. So you can just check out JBI wherever you're working in and find out where is the next workshop available, and you can enroll in that. So that is how it is. They'll come, they'll say where it's coming, how it's coming, and it will actually give some idea. So we have a workshop coming up in November. It's from 24th to 28th November, in which we have some trainers from University of Adelaide as well. So this is as a part of our, we are organizing the JBI International Conference this time in Kochi, Kerala. I'm from Kerala, is where we're going to conduct that, and it's coming up in November. And as part of this, we are going into, we are conducting a review workshop also. So if you're interested, you can let us know. So that's it. Any questions? I'll be happy to answer.
Thank you, Dr. Vinita.
Yeah.
Very nice presentation, and this is a topic which we all dentists or public health dentists must
Yeah. Thank you, sir.
incorporate in our research in coming future. We have a question. One is by Dr. Navdeep.
Mm-hmm.
Little bit more about reciprocal translation.
Yeah. So this comes in meta-ethnography approach, in which we have findings from each studies, right? Different studies. Okay. And how the same thing happens across studies. If it is based on say, similar findings, we say it as reciprocal translation. One study agrees, other study agrees, other study agrees. It's reciprocal translation. If there is also one more concept called refutational translation. Okay, so one study agrees, other study does not agree. Okay, it contradicts each other. Then we have to make sense, right? We have to do a meta inference, like what to make sense of that. That is refutational translation. So these are just ways in which you can synthesize evidence. If this many studies agree, so this you can put forward, and there are different aspects to it. Like one agrees, one disagrees. So you can understand that also. So just few points in which we can do a meta-ethnographic approach. So I would suggest, if you're interested, look at examples by Noblet and Hare. There's clearly they have given with examples how to do reciprocal translation, how to do refutational analysis. And there is also some methods called as translation. They have some pointers in which how you can do it very clearly.
What I can make out is since we don't have numbers to combine or as in quantitative systematic review, and we are just looking at the findings. So you are saying that findings where you agree and where you don't agree, you segregate that. That's basically the refutational and the reciprocal, if I'm right.
Yeah, yes, sir. Yes, sir.
Numbers are not. Second question is, it's an interesting question by Dr. Jasmeet. He's saying, can we use methodology for mixed method research?
You're asking about evidence synthesis for mixed method?
It might be saying that there are quantitative study and there are qualitative study, but there are mixed method research also. So if evidence synthesis can be done for them also.
Okay, so there are two things here. One is in qualitative systematic review, you can take the qualitative component of the mixed methods and do the qualitative systematic review. Okay, you're leaving about the quantitative component. If you're, so it's allowed to take qualitative components from mixed method for qualitative evidence synthesis. Okay. Now there is a separate line of mixed method evidence synthesis. Okay, in which both quantitative and qualitative data you can take it. Okay, and there are three to five methodologies on how to do it. You convert one data into another. There is qualitizing, quantizing, very interesting. Okay, and you can do both meta-analysis and meta-aggregation in mixed methods. So to answer that, yes, there are two different methodologies. You can take qualitative data for meta-aggregation and do a qualitative systematic review, or you can take both and do a mixed method systematic review. It really depends on your research question. Methodologies are available and well established.
I hope
I'm clear.
You answered your question. Dr. Vinita, if you have some literature, you can share it with us. We can share it with the participants regarding this methodology.
Sure. Mixed methodology. Okay. Yeah. So you can just go to JBI website. There is guidance on mixed methods as well. And I can share the slides. I don't mind. I can share the slides.
can please share it. The third question is by Dr. Pratibha. She wants to know whether we can register umbrella review as Prospero.
Yes, you can
I
register umbrella review in Prospero. Yeah.
think that Prospero has no scope for it as of
Prospero will accept umbrella reviews. It will not accept scoping reviews. Scoping reviews, you need to register in Figshare or Open Science Framework. All the other type of reviews, literature review also they won't accept, but all the other type of systematic reviews, Prospero will accept.
Yeah, and one more question. She's saying I'm performing a mixed method study design,
Mm-hmm.
and in qualitative part, while deriving the themes, the redundant saturation is achieved overly. In those cases, can themes be generated manually without any software help? I think it can be done. Software is not always required. I think that. Yeah, but
Absolutely, sir. We all
Yeah.
started manual,
Manually.
getting that Excel sheets, pinning it, notes. That's how we all
Yeah.
started. But since we all became lazy after some time, these softwares are there. It gets the job easier. But if you don't have funding or something like that, you can do it manual. It's no issue.
I think that's all question we had. I would like to say. Otherwise, we'll close the session.
I just see in the chat now.
Thanks to all the participants. Vinita, thanks for your time.
Thank you. Thank you so much, sir.
If anyone wants to go and check this webinar, they will be available on YouTube to our YouTube channel. The core program has a YouTube channel, or you can go to our website also. This webinar will be available, recorded. Okay, thank you very much. Have a nice day.
Thank you, everyone.
Thank you, ma'am. Thank you so much.
Thank you, Asha.